Are steroids your go-to for quick eczema relief? Today, we're exploring the hidden risks of topical and oral steroids, including dependency and withdrawal symptoms. We're also going to talk about safer long-term alternatives for eczema treatment and special considerations for skin of color. My friends, it is time for us to rethink how we use steroids in our eczema management. This podcast is made in partnership with the Allergy and Asthma Network. We want to thank Sanofi and Regeneron for sponsoring today's episode. While they support the show, all opinions are our own, and sponsorship doesn't influence our content or editorial decisions. Any mention of brands is for informational purposes only and not an endorsement. Now let's get into it. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
So today we have another special guest, Dr. Mandy Gias, and she is a dermatologist. And today we're going to be talking about atopic dermatitis and systemic corticosteroid use. So Mandy, could you introduce yourself a bit to the audience?
Yes, absolutely. I am Dr. Mandana Gias. I'm a board-certified dermatologist, and I'm based in New York City, and I specialize in three key areas. So chronic inflammatory skin conditions like eczema, skin of color dermatology, and telehealth. And one of the reasons Dr. G and I bonded so quickly is because we both have this passion for helping patients get access to the care they need through telehealth. And so I co-founded and am the chief medical officer of Tono Health. And it's been a really exciting time because we now have an incredible group of 25 board certified dermatologists and allergists. We have practices in about 30 states, and we're able to reach over 80% of Americans. So I'm really excited to be here with you today to talk about steroid use and eczema. I see patients across the country every day, and this topic comes up all the time.
Welcome. I'm very excited to have you, and I think it's really cool what you guys are doing, bringing more access to patients, especially with dermatology and allergy. I know that myself, living in a big city, even though we have lots of dermatologists and allergists, it's so hard to get to them. So thank you for what you're doing, and thank you for making it easier for patients. And it's also just very exciting to see where technology is going in the medical world. Anyhow, we're talking about systemic corticosteroids and eczema, or atopic dermatitis. And I want to just dive into what we mean by systemic corticosteroids, because I also know that when we were originally thinking about this podcast episode, we were using the term oral corticosteroids. So can you tell us a little bit about what role they have in eczema treatment?
Yes, absolutely. So corticosteroids, also called steroids, are medications that calm down inflammation by impacting the immune system. Eczema causes red, itchy, and inflamed skin, and so steroids can be used to quickly lower that inflammation to make your skin feel better. But the concern is that steroids don't really fix the root cause of eczema and are really meant to be more of a short-term bridge as we focus on finding safer long-term treatments to keep the eczema under control. When it comes to systemic steroids, steroids come in many different formats. So it could be topical steroids or ointments that go directly on the skin. And then there's also oral steroids that could be taken as pills or IV steroids. But really, the systemic steroids are meant to be used even less often, really just as needed for severe flares or if you go to the ER or urgent care.
So steroids come up a lot with atopic dermatitis, which I'll probably refer to as eczema from now on because that's a mouthful. And I know that we think a lot about the ointments and the creams, so putting it on. But when we talk about systemic steroids, which we're talking about today, that's like the pills or what we talked about in our last episode where we talked about steroids and asthma. It's also something that you can get through an injection or IV. So we're talking today not about so much what you're putting on your skin, but what you're taking into your whole body. And so systemic really means it's going to be impacting your whole body, not just the skin. With that in mind, how might systemic steroids be helpful for eczema? And why is someone taking a systemic steroid instead of just putting it on their skin where the eczema is?
Yeah, so systemic steroids can be helpful for eczema flares. So if things get really severe, really painful, and nothing else seems to help, they can quickly bring relief, but they are not meant to be used for long periods because of the potential side effects. So the goal with systemic steroids is to calm things down when necessary and then transition to a safer long-term treatment that can manage the eczema consistently over time.
So this is just a curious question, and I know that I've been in a place once where we were debating on giving me oral steroids because of some other treatments that I was doing. I couldn't go on an oral steroid, so we figured something else out. So at what point is it so bad for a patient that they're actually going to go on an oral steroid?
Yeah, I would say that if it's involving so much of the body surface area, if you're having trouble sleeping, if it's impacting your quality of life and you've been trying topical steroids, and sometimes when patients go to the ER room or to urgent care, these can be used as a short-term solution while the patient transitions to a physician or provider that they're following with over time who can really find that optimal solution for them. While they can be useful for these very acute short-term flares, it needs to be coupled with a better long-term solution.
Yeah, and Mandy, I'm really glad you brought up the emergency room and urgent care centers because I bring this up every time we talk about asthma, but it's also relevant for conditions like eczema and even urticaria. When you go to the emergency room or the urgent care, again, they want to use the quickest solution to make you feel better. These physicians are trained in a very particular way, and that's to resolve the issue and make sure that you're going to get relief from the acute issue that you're having. They're not trained in what we're talking about, which is the longer term medications that are targeted. They don't have that education for every single disease state. So really, they're going to be going in to make sure that that inflammation is controlled, as Dr. Giaz mentioned. Those are really important things to remember. And I've seen that even patients with eczema and urticaria, for example, use the urgent care and emergency centers as their primary contact.
Yeah, I mean, I think that it is so interesting with a lot of my eczema patients. They have been kind of going through this cycle, going to the ER room repeatedly, and a lot of times they do get a referral to a specialist, but potentially because sometimes in that very acute time frame right after being on systemic steroids, people's skin clears up and they're like, all right, I'm all set. But then most often it does come back. And so what we're trying to avoid is really this cyclical process of using systemic steroids as more of a band-aid instead of being able to find a solution that doesn't have as many side effects and that's going to be safer to use long term.
So you said side effects. Let's talk about those because today's episode is really a big warning as to why we don't want to be taking systemic steroids for eczema. So what are the side effects of oral or systemic steroids?
So, some of the side effects that people might start noticing, especially if you're on repeated courses of steroids or using them for longer than intended, some of those side effects are things like gaining weight, mood swings, trouble sleeping, getting sick more easily or frequently. Sometimes people can be feeling more tired or just report not feeling quite like themselves. And so, these are signs, like you were mentioning earlier, Courtney, that the steroids are really affecting your body beyond the skin, which is why we really try to limit steroid use and look for long-term safer treatment options.
So just to be clear, because I know that on our last episode where we talked about using steroids in asthma, we said that if you use steroids more than twice a year, that's a red flag that you should really be seeking more care with a specialist. But how much is too much with eczema? Is it the same thing? Anything to do with, oral steroids is kind of across the board the same. Too much is more than twice a year? Or is there another warning to say, you're using it too often and you're going to get these potential side effects?
I know that we had said twice a year, but in my opinion, and I'm sure Dr. Giaz might agree, even once a year is too much at this point, considering all the great targeted treatments that we have available and the known consequences of systemic steroids. So Dr. Giaz had mentioned all of the kind of more immediate consequences of using systemic steroids, but it can also over time weaken your bones, which is osteoporosis. It can increase your risk for diabetes, or if you already have diabetes, it will raise your blood sugar and affect the underlying diabetes. It can cause cause cataracts in your eyes, which can cause blurred vision and can lead to surgery. And it can, as Dr. Giaz mentioned, can also inhibit your ability to fight off infections and affect your immune system over time. So really for me, given all of the new alternative treatment options we have available for all of these disease states, I would say even once a year is too much, and we should be able to control your eczema with other treatments. However, sometimes people are exposed to something that causes a flare that's out of their control. So once a year may happen, but once we get a better handle of what those triggers are, then we can also avoid those more effectively.
Yeah, absolutely. I mean, I think it's also about recognizing that eczema is a chronic condition, trying to figure out what is our goal with these systemic steroids. So, in my practice, if a patient needs systemic steroids for an eczema flare, my goal is really at that same point for us to figure out, okay, what is our plan for after this flare resolves? Because we know this isn't the best solution for you long term, is these repeated intermittent courses of steroids, and figuring out what some of the better options that are also safer to use long term and how that looks.
Yeah, it sounds like systemic steroids are really nice for an eczema patient because you get kind of like this instant gratification feel of like, my skin looks great. But I know from personal experience that if you don't maintain your skin, it'll come back, or it'll potentially come back if you encounter a trigger. So it sounds like it might be a bit more of a challenge for a patient to want to seek help further. But we really have to, I think at the end of the day, what I'm hearing is that if you ever have to use oral steroids, you definitely need to get yourself hooked up with a specialist so that you have a maintenance plan in place.
Yes, I mean, I completely agree. I think it's really working with a specialist who is able to find that ideal treatment plan, because conditions like eczema really impact everyone so differently. And so, whether it's identifying those triggers or figuring out what combination of treatments works best for you and your lifestyle is really going to make a big difference.
And one other topic, because Dr. Giaz is actually a specialist in skin of color, as she mentioned earlier, is talking about the differences and how topical steroids in particular, not necessarily systemic steroids, can affect patients with skin of color. Dr. Giaz, can you talk a little bit about that?
Yes, definitely. There are multiple aspects. For example, eczema flares can present differently on skin of color, and then also the response to certain treatments like topical steroids can have different side effect profiles. So, one thing that patients come in with that is incredibly distressing or just frustrating, the side effects, is getting hypopigmentation, or basically noticing that their skin is getting lighter in certain spots where the topical steroids are being used more often. And so, being mindful and thoughtful about some of these differences with melanin rich skin is really important to take into consideration. Also, one other difference is, with children, they have very thin skin. And so steroids can cause side effects more quickly than you would otherwise expect. And so just being mindful about some of these long-term side effects and finding safer ways to control eczema is really what you want to work with your doctor on being able to find.
So, are we saying that systemic and topical steroids are something that we could potentially and we should try to limit as much as possible in management plans?
So systemic, absolutely. Yes. We want to limit that as much as possible. If altogether, that would be ideal, of course. And then when it comes to topical steroids, really tracking and monitoring how often you're needing them over time, because if you're noticing that you're needing to use the topical steroids more frequently or using higher strength topical steroids, those are some of the signs that perhaps your eczema isn't getting better controlled and that your skin is becoming dependent on it. And so figuring out what other options there are that can minimize that dependency on the topical steroids is also really important.
So, Dr. Giaz, I think what you're alluding to are two different things: topical steroid withdrawal and also the rebound effect of systemic steroids. So, can we talk about those two topics really quickly?
Yeah, absolutely. I know in psoriasis, this is a very common aspect where if you're treating psoriasis flares with prednisone or systemic steroids, that there is a risk of rebound where the condition actually comes back worse. And so it just increases that importance of what is our long-term plan when using systemic steroids and being judicious. And it's really, really intended to be a bridge rather than, oh, this is my like long-term plan, especially because with eczema treatments, we have so many new options that are really targeted and are really focused on that specific pathway of inflammation and driving the condition, that it really leads to minimal other side effects and an incredible ability to get eczema under control.
So, if I understand that correctly, if you're taking systemic steroids for your eczema and you stop, you have the chance of your eczema coming back worse more often or just coming back worse right after?
I would say it's really that if you are using systemic or topical steroids long term or incorrectly, or just using them more long term as, oh, this is like the mainstay of my treatment plan. Some of the ways that we like to monitor whether people's eczema is improving and heading in the right direction versus trending in the wrong direction or getting worse is really how often are they using these medications, and when they use them, is the eczema flare lasting the same length, or is it actually resolving even more quickly versus is it taking longer? So, some of the aspects are just increased tolerance to the topical steroids or like dependence to it. And when stopping topical steroids or this withdrawal aspect, I think it's really about, was there a plan put in place of something that is a non-steroid treatment that would prevent the eczema from coming back or from patients experiencing any worsening of symptoms after stopping the medication?
Yeah, I think the important thing to remember is that when you're on a systemic steroid, you will likely get clear skin. And then once you come off of the systemic steroids, and oftentimes if you've been on them for a long period of time, we do what's called a taper, which means that we slowly bring you off of the systemic steroid and we slowly, week after week, reduce the dose that you're on in order to prevent your body from going into something called adrenal insufficiency, which means that your body's way of fighting off any kind of distress is to release its own steroid from your body. And when you're taking external steroids into your body starts getting confused, and your adrenal gland, which is the gland that releases the steroids from your own body, stops working correctly. And so we need to slowly pull you off of the systemic steroids in order for your body to continue to do what it needs to do with the amount of steroids that your body naturally needs. So that's one aspect that a lot of people get confused by. And starting and stopping systemic steroids, sometimes people will have a stash at home that they turn to and they'll start using them here and there, and that can get very dangerous. So there's lots of nuances to systemic steroids and even topical steroids, and how it can affect your body over long term, and how it can increase the severity of your condition to a certain degree over the long term, because your body may get used to needing that treatment, but then the side effects will start catching up to you also. So it's just, again, when you're working with a specialist, we know all of that, and we can make sure, as Dr. Gia said, that we're bridging you appropriately and that we're putting you on the right treatment path where you're able to come off of the systemic steroids or the topical steroids.
So right now, at this point in this episode, I'm hearing systemic steroid and I'm hearing topical steroid, and I've kind of like equated them to being both not good. Can we just really help me understand whether that is true, or if there is really a place and time for steroids and then you want to eventually, like Dr. G said, taper those out of your life as well?
I mean, I think that when it comes to the topical steroids, if someone is only, let's say, using a very small amount or very intermittently. Maybe they get like one small area of eczema in the winter, and after using the topical steroid, it kind of clears up, and they're able to maintain that skin clearance with just using really great moisturizers or the rest of their skincare routine. That's probably perfectly fine to continue with that. But some of the aspects that make it more concerning are really if people are needing to use these medications more frequently, they're going back to their doctor and needing a higher potency topical steroid, which means topical steroids come in many, many different strengths, even just the strengths that we're prescribing very regularly, because we want to give our patients relief as quickly as possible, of course, has been going up pretty regularly. And so, whereas before, maybe people were using just a small amount of hydrocortisone ointment, and now we're handing out clobetasol, it can be really helpful for certain skin conditions, again, like psoriasis or conditions where the skin is really thick. While it can be useful for very select situations, it's probably not intended to be the go-to for eczema patients who are having recurrent flares over time. Again, a lot of times if one of my patients is having an acute eczema flare, or even if they are coming in and they've been having recurrent flares, for that short-term period of time, we may use a topical steroid to kind of get things under control, but I'm usually coupling it with some kind of long-term treatment plan, whether it's a topical or an injectable or an oral medication. What are the options that are going to keep things under control? Because another aspect that I think is really important to consider with eczema is how can we get to a place where we are proactively preventing eczema flares instead of just waiting for things to get so bad that people are coming in so much pain and suffering, needing systemic steroids. How can we really get ahead of that and come up with a better solution that helps our patients live their best lives?
Yeah, and we had talked about the hypopigmentation from topical steroid use, but if we treat inflammation too late, then we can get some of those other things like hyperpigmentation in people with skin of color, and actually even in lighter skin, you can get hyperpigmentation from the inflammation. And then also you can have thickening of the skin or lichenification of the skin that is harder to reverse. And so all of these things from prolonged inflammation can also lead to consequences that are harder to manage and rectify after the fact. So proactively making sure that we're treating that inflammation is key.
Yes. And one other really interesting aspect is that there has been a lot of recent research that is looking into what is the systemic level of inflammation that can be seen in atopic dermatitis or eczema. That also impacts how we're going to be treating or our approach to the condition, because some of these targeted treatments can have additional benefits that really extend beyond just the eczema on your skin as well. I'm sure you have talked about the atopic triad, really these medications that are able to treat multiple things for our patients and help both their asthma and their eczema and allergic rhinitis. It's just been incredible to see the outcomes and just people's lives being so much better, not having to apply creams all over their body 2 times a day. Nothing breaks my heart more than when kids come in and they're just completely greased up and having to do this twice a day, and they just want to play outside with their friends. And so giving people those options really makes such a big difference.
You just totally described me. I feel like this episode is speaking to me because I have been on that journey where I was really afraid that I was pretty much overusing topical steroids, and it's been a bit of a journey. Everyone who's listened to this podcast, just listen to all eczema episodes and you will go on that journey with me. So you definitely hit on something that's very close to home. But can we just unpack a little bit what those other treatments other than steroids look like, just so that our audience kind of has an idea of what they could be looking at to help manage their eczema if they've never heard of anything other than like hydrocortisone cream?
Yes, definitely. So some of the other options are treatments like biologics or these targeted treatment options. And there are systemic versions or injectable versions, oral versions. And then there are also topical versions now, which is really great. And basically, with these targeted treatments, they're much more precise than what we were able to achieve with prednisone. And so instead of impacting the whole immune system and shutting everything down the way that prednisone or steroids do, with the targeted treatments, they are really only impacting the specific aspect involved in eczema or allergic conditions. And so with that, we see a much more precise outcome, fewer side effects, and just overall much better disease control.
Yeah, and I think what's also different between the asthma conversation and the eczema conversation with the biologics is that we do have oral versions of these targeted treatments for eczema, and we don't have those for asthma. All of the asthma biologics are injectable, whereas for eczema now, we do have some oral options that are in that category of targeted treatments. So there are some differences between these two patient populations and the treatments that we can offer. And of course, the topical treatments, as I had mentioned earlier, we have the non-steroidal forms for our atopic dermatitis patients.
Yeah. And one other aspect that I think is really interesting, especially with the injectable treatment options, is I completely understand, especially at the beginning, some of the anxiety and stress and fear around what is that going to look like? Do I need to be doing these injections every day? Oh my gosh. I think that after having proper conversations and counseling, and also just really the patients experiencing it, and then seeing how different their lives are afterwards, that they're like, oh my gosh, I can't believe I didn't do this sooner. That fear or hesitation really drastically reduces over time, because the cost benefit analysis of, do I want to be miserable every single day versus this is going to be a 10 to 20-second endeavor that isn't going to be quite as bad. And there's a lot of strategies to make them more manageable.
Yeah, absolutely. Needle phobia and being worried about injecting yourself when a topical treatment or putting something in your mouth just seems a lot less invasive. But you're right, the benefits and not even having to do it on a daily basis. Most of these biologic treatments or targeted therapies are every 2 to 4 weeks in how often you need to use them. And now, as we're moving forward, I'm seeing new research onto treatment options that might even be every 6 months for asthma, for example. So there is just so much movement in these targeted therapies and what we may be able to do for patients and just provide less cumbersome treatment regimens. Because just even thinking about my son, he's kind of turning into this little allergic kid and trying to do all of these things when he is having his seasonal attacks. It is a lot. And it's a lot to put that in between the school schedule, getting ready in the morning, and then also keeping on top of making sure that you're using all the medications that you're supposed to. So it's just going to make things easier for everybody.
Yeah. And I think the other aspect is that these treatments are just getting better and better over time, like you said. So I think it is just a really exciting time in that aspect where there is so much innovation and research that's really improving things for eczema patients everywhere.
We first started this conversation talking about taking systemic steroids, which means that you are really at your utmost miserable, worst eczema flare, and you need something pretty drastic to help you get there. Is there a point that someone could go, my skin is potentially getting there, but I can stop it or I can get on one of these amazing treatments that you guys have been talking about? What is a warning sign for a patient to go, your skin needs some help, go to a specialist?
That is a great question. I would really say that if you're noticing that you're having more frequent flares, they're interfering with your life, if you're needing to use the medications more frequently, or just experiencing worsening symptoms, I mean, I think that it's never really too soon. I think you can always consult a specialist just to come up with a a plan and to, again, have that proactive approach in having a game plan if things do get worse, because people coming in who just want to hear about the options, and that hearing about the options and knowing that they exist, even if we're not going to use them right off the bat, gives people that sense of comfort. I know it's going to be okay. Right now, I don't need any of these things, but knowing that they're there just is like an additional layer of support. And stress can exacerbate eczema too. So just knowing what your options are can even make it a big difference.
Well, this episode, I have to say, has been a lot of fun for me because it's like looking back and thinking, oh, I've been in many of these situations and I have gone on this journey. I've heard a lot of myself in this. So I want to thank you. And I just want to summarize really quickly some high-level points about what patients can take away. Half of this is also from lived experience. But if your skin is not feeling good, it's never too soon to see a specialist. And you want to try and really see a specialist when it comes to eczema because they're the ones who are able to prescribe these really amazing medications that are out there that can help you gain control. And they know what's available because, like what Dr. G had said earlier, is that urgent care or ER doctors, they just want the quick fix. They're going to give you the systemic steroid and you're going to feel really good afterwards. But that's not going to bridge you. That's not going to help you. And that might make you land right back in the ER. And you want to get long-term control because, like Dr. Gia said, this is a chronic condition. So it's not going away anytime soon, unfortunately. So you want to really work with someone to find the right treatment plan for you, and you want to get control fast so that you don't end up in the ER.
Yeah, thank you so much, Dr. Giaz, for being on here. I know as a startup founder, you are so busy, but I wanted to have you on here because I know you're just so full of knowledge and you have so much experience in all of these conditions. Thank you for sharing all of your knowledge and taking time out of your day.
No, thank you so much for having me. This is a topic I'm incredibly passionate about, and I love the podcast, and it has been an absolute pleasure. So thank you so much.
Thank you so much. And I just also want to say one thing is like, what's really cool about skin conditions is that you can do these with telehealth, right? Because it's not one of those things where you actually have to be sitting in front of a doctor, because mostly like you're just looking at the skin, which you can see over the camera or through pictures.
Yeah, exactly. And we usually do a combination of those. And with modern technology, a lot is possible. So it's been incredible to see.
Awesome. Thank you.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.